I'm Jac Nickoloff, and I'm the head of the Department of Environmental and Radiological Health Sciences at Colorado State University. And today my talk is going to be about carbon ion radiation therapy, as well as other, I want to touch on radiobiology aspects, some clinical aspects, and also talk about some future developments in the field of particle radiation therapy. RRS is an excellent fit for this lecture because RRS covers a very broad range of topics, just as my talk does. Radiation therapy is quite a successful modality for cancer therapy. The other choices are surgery and chemotherapy. And so radiation therapy has two big advantages over those other types of cancer therapy. One is that it's non-invasive, and the other is it doesn't have any systemic effects, so it's very local, so it's perfect for dealing with local control of the tumor itself. Radiation therapy is not suitable for systemic or for disseminated disease, metastatic disease. So oftentimes what people are doing now is using radiation therapy combined with chemotherapy to handle those more advanced cases. So there are three modalities in radiation therapy that are currently being used. X-ray photon therapy is the dominant throughout the world, dominant modality. Proton therapy is coming on strong now. Is a small particle radiation therapy. Protons are the smallest particle that you can accelerate and into a patient. And then carbon ion radiation therapy was actually pioneered in the U.S. at the Berkeley labs back in the 70s and 80s, but those projects were dropped and then picked up by the Japanese and brought to clinical practice in 1994. And approximately 15,000 patients have been treated with carbon ion radiation therapy. So one of the big topics we're going to talk about, in addition to the basic science that underpins this therapy, is that problem with how do we bring a technology like this to the United States. So there's been a steady improvement in the targeting, and there's been steady increase in the use of radiotherapy over the decades. And just to give you one example, so in 2008, as late as 2008, about half of U.S. patients were getting radiation therapy as part of their cancer treatment. And now that number, in just a short period of time, has increased to 75% of patients. And the reason is because, as I said, this is quite effective therapy. It's also very patient-friendly. There's virtually no side effects. There's no pain. It's not invasive. Those are the highlights of my talk.